What does a bone cancer pathology report mean? Imagine you have a bone tumor and your doctor orders a biopsy to find out what it is. The tissue sample is sent to a pathologist who carefully examines it under a microscope. The pathology report they prepare is like a detailed map that guides your treatment and helps predict how the disease might behave. It tells your medical team exactly what kind of tumor they are dealing with. They look for signs of whether the tumor is benign, meaning non-cancerous, or malignant, which means cancerous. If it is cancerous, the report specifies the type of bone cancer, such as osteosarcoma, chondrosarcoma, or Ewing sarcoma. This is important because each type can grow and respond to treatment differently. The report also includes the tumor grade, which shows how aggressive the cancer cells look under the microscope. Higher-grade tumors tend to grow faster and are more likely to spread, so knowing this helps doctors decide how intensive the treatment should be. It describes the size of the tumor and how far it has spread within the bone or to nearby tissues. The report notes whether the tumor is close to important structures like nerves, blood vessels, or joints, which can influence surgical options. Another key part of the report is the surgical margin status. If the tumor was removed surgically, the pathologist checks if cancer cells are present at the edges of the tissue. If no cancer cells are at the edges, the margins are negative, meaning the tumor was likely completely removed. If cancer cells are at the edge, the margins are positive, indicating some tumor may still be in the body and further treatment might be needed. Close margins mean cancer cells are near the edge, so careful monitoring or additional therapy could be necessary. For tumors treated with chemotherapy before surgery, the report may include the percentage of tumor cell death, called necrosis. A higher percentage suggests a good response to treatment. If lymph nodes were biopsied, the report will say whether the cancer has spread to these immune system organs. Modern pathology tests may also include molecular or genetic analyses, which help refine the diagnosis and can guide targeted therapies. The quality of the biopsy sample and how well it represents the tumor are also assessed. The pathologist correlates their findings with imaging and clinical information to ensure the diagnosis is accurate. This report is crucial because it helps your medical team choose the best treatment plan, whether that involves surgery, chemotherapy, or radiation therapy. It also provides information about prognosis and the chance of the cancer coming back. It is very important to discuss your pathology report with your oncologist or specialist. They can explain what each part means for your specific situation. In some cases, seeking a second opinion from a specialized center can be helpful to confirm the diagnosis and ensure the best treatment approach. Remember, every case is unique, and your healthcare team is there to guide you through understanding your diagnosis and options. In summary, a bone cancer pathology report translates microscopic and molecular details into vital information that shapes your entire care journey.